Pain is an unpleasant sensory and emotional experience. Different animals, like different people, will have very different experiences of the same pain. Acute sudden pain is necessary in terms of survival and signals a threat to the animal. However, ongoing pain does not have any beneficial effect and should be treated. In general, there are several types of pain based on where in the body the pain is felt and how it is felt. Acute pain is most often associated with injury or surgery and has a predictable duration. It is generally provoked after the activation of peripheral nociceptors. The function of acute pain is to protect the human or animal from danger, reduce further injury and pain, and convey a message to the brain to respond, usually in the form of releasing chemicals such as endorphins to lessen the pain. Dogs may yelp or whine following an injury which alerts the guardian to investigate. A veterinarian may prescribe simple analgesia such as paracetamol or a short course of non-steroidal anti-inflammatory drugs for an acute injury or post-surgery. Uncontrolled acute pain can lead to chronic pain, which persists after the damage is resolved. Chronic pain is ongoing, often intermittent, and may persist for months or years. It may be associated with cancer or arthritis, or may have begun as acute pain. Chronic neurogenic pain may also arise spontaneously with no apparent cause. Somatic pain occurs in body tissues and organs outside of the main body cavity, such as the skin, muscles, bones, and sense organs, and is usually localized. Examples are musculoskeletal injuries, skin inflammation, fractures, and arthritis. The term somatic can also be used to describe signs of stress. Visceral pain occurs in the internal organs located in the abdominal and thoracic cavity. Visceral responses can have an emotional or instinctive reaction. Some common causes of visceral pain in dogs are pancreatitis, gastroenteritis, and gastrointestinal obstruction. Neuropathic pain is chronic pain involving the nerve pathways and is often difficult to treat as it doesn't respond to conventional analgesia. Referred pain is where the pain is felt some distance away from the original injury or problem. Examples are pain in the left arm from cardiac pain or pain in the shoulders from an ectopic pregnancy. Gastrointestinal disorders in dogs can often present as ear pain. Psychosomatic pain is associated with stress and psychological related problems. This pain may be magnified or distorted. It can develop independently or as a result of chronic pain. Several types of pain can be felt at the same time. It is important to understand the pain pathway to decide on the most effective way to treat pain. Transduction is at the site of the local injury, which activates the cutaneous or visceral pain receptors, known as nociceptors. This could be a joint, an organ, or teeth, for example. Transmission is the pain receptors transmitting the pain signal via the peripheral nerves to the spinal cord. There are two types of afferent sensory fibers, myelinated A delta fibers, which conduct fast, sharp pain, and non-myelinated C fibers, which conduct slower, dull pain. Modulation is the pain receptors in the spinal cord receiving and processing the pain signal through the opioid, serotonergic, and noradrenergic endogenous systems. Various chemicals facilitate continuation of the signal to the brain. Perception is the brain receiving the signal and sending out efferent signals instructing the body how to respond. Perception of pain is emotional and subjective. Central sensitization occurs in the spinal cord and is commonly referred to as wind-up pain. Central sensitization amplifies the original signal and experience of pain and can lead to maladaptive pain. Hyperalgesia is when more pain is felt than is normal for the stimulus, and allodynia is when something that normally doesn't cause pain becomes painful. An example would be the touch of a feather being perceived as painful. Research suggests that both guardians and vets are not very good at recognizing pain, and because dogs can't tell us about their pain and are often very good at hiding it, it may lead to the belief that they don't feel pain in the same way as a human. However, the pain pathways in both species are identical, and well-defined criteria as to what is required to feel pain exist. Dogs and many other animals fulfill this criteria, which are the possession of nociceptors that detect damaging stimuli on or in the body, pathways from the nociceptors to the brain, structures within the cerebral cortex that process pain, opioid receptors and endogenous opioids, a reduction in adverse behavioural and physiological effects after administration of analgesics, learning to avoid potentially painful stimuli, and that this learning is rapid and inelastic. There are several physical signs of pain that dogs may exhibit: an increase in heart rate and respiratory rate, posture changes, for example being hunched up, gait changes, limping, appearing stiff or awkward, skipping or bunny hopping, crying, whimpering or yelping, being reluctant to jump into the car, go up and down stairs, go on a walk or play, struggling or slower to get up or lie down, pupil dilatation, and fur pattern changes. And some dogs may show no physical signs at all, and many guardians are convinced that pain isn't an issue as their dog is physically behaving exactly the same. Coat and fur pattern changes are particularly interesting. These are caused by the muscle and fascia changing underneath the fur. This was recently discovered during trials where mice were injected with RTX, a chili derivative, which caused rapid depigmentation through damage to stem cells. These pattern changes were then reversed when analgesia was administered. The first picture on the left shows my 11-year-old GSD who had a swirl over his right hip, which encouraged me to visit the vet, where he was diagnosed with arthritis. The central picture is 2 weeks after starting an anti-inflammatory drug, Prevocox, showing the fur has become smooth again. The third photo on the right shows a Labrador that developed coat changes and was found to have a slipped disc. Questions the guardian can ask are: does the coat feel brittle, dry or scurfy in specific areas and different in others? Are there areas of fur that constantly stick up or out? Are there swirls or partings where the hair changes direction or lies flat or raised? Is it harder to run your fingers through the coat in certain places? These signs can all indicate signs of strain in nearby or underlying soft tissues, where circulation may be compromised or there is muscle tension. The patterns may not be where the problem is, but they could tell you your dog is using their body in a way that is putting it under strain. Combined with the other observations we make, they can give you extra information and clues. Some of the behavioural changes that guardians may see when a dog is in pain are changes in personality, restlessness, agitation, anxiety, avoidance, hiding, aggression, growling, snapping and biting, new fears or phobias, withdrawn, asking for space such as stress signs on approach, lip licks, yawning, head turn, for example, licking, biting or rubbing an area or excessive licking of surfaces, tail chasing and other repetitive compulsive disorders, food issues, refusing to eat, ravenous, pica, resource guarding around food, and house soiling. A study that examined the association between pain affecting behaviour cited a wide range of 28 to 82% of behavioural problems having a pain component. Their study reviewed 100 cases from the UK, Bristol and Lincoln, the US, Pennsylvania, Missouri, and Spain, Barcelona, with the figure of 82% coming from Lincoln and the 28% from Barcelona, of cases where a painful condition was suspected. Though I have often heard this study's figures misquoted in webinars, it has increased awareness of the association. However, this knowledge is not new and has been known for some time. An article in 1998 described numerous signs of pain that vets or guardians may see, amongst which were changes in temperament, including fear, aggressiveness, hyperexcitement, unusual response to the guardian or other animals, self-mutilation, vocalization, and hiding.